Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a Mulleteer, visit us on Patreon. We appreciate your support. All right, well, it's 1 o'clock, so welcome to the InfoMullet Facebook Live Ask Me Anything. I am Timothy Clancy, the Chief Mulleteer, and today we're going to talk about COVID-19. So first of all, it's very important that you don't touch your face with this disease, and since I'm about for a half hour of live video, I feel it's important to get this out of the way first. There, I've touched my face. If I touch my face now at any point in the video, you don't have to call me out on it. You don't have to remind me not to do it. I've already done it. I'm a trained professional. Please don't do this at home. Also, thanks everyone for supporting the InfoMullet. We're doing a Patreon run right now to start, so I'll put a link for the Patreon. But if you're on the Facebook, it's at the Learn More button. You can go to patreon.com/InfoMullet. And we appreciate all the Mulleteers who have signed up. I see a couple there right now who have already signed up. And I'll be adding links. Unfortunately, Facebook Live doesn't let me present data as a shot. So I'll add links. And when this goes up on YouTube, all the links will be in the video below. So let's start out with a brief of where we're at. Globally speaking, where this began in China has actually run the full course, it looks like, of an outbreak. We've seen China go through the early stage where there wasn't much growth. They had the outbreak with the exponential growth. They put in all the measures, and we'll talk about whether those measures are effective or not. The daily cases to China has now dropped to a fraction, and we're seeing pretty much in the full life cycle of what it looks like for one of these outbreaks. And I will add first comment here. If you go to this that InfoMullet I just put up there, there's charts. We're tracking 35 countries now across 7 regions. So what we saw in China is now beginning to replicate in different regions around the world. And so where are we at? Well, China, we know what happened there. They had about 70,000 cases, 25 to 3,000 deaths. It was very bad, but it seems to be contained right now, and we'll get into whether they're reporting accurately or not. But what we've seen in the last couple of weeks is this pattern of initial infection, low initial growth, and then rapid exponential growth begin replicating in different regions of the world. And by sort of way of quick overview, the worst place that were hit are not the ones we might think they were. For example, South Asia, Bangladesh, Pakistan, India, these were areas with very, very high concern, and yet there's no evidence yet that's coming through the World Health Organization or even people talking to local doctors there that they're experiencing the kind of conditions yet that are happening, for example, in Northern Europe and Southern Europe. It turns out the region that's getting hit the hardest is actually Europe. And there's a couple reasons for that we're going to go into. Middle East, Iran has struggled very hard with this, and we're starting to see some in Iraq and the Gulf Cooperation Council, Kuwait, Saudi Arabia, places like that. And then obviously North America, a lot of concern with the United States and Canada. Not a whole lot of cases in Mexico. South America, there's virtually no cases. I was looking, there's a handful of cases here and there. When you get into Southeastern Asia, sort of Malaysia, Indonesia, Australia, again, there's cases worldwide, but the real epidemics seem to be breaking out in Europe mainly, Iran, and there's obviously a concern that the U.S. is not going to be far behind. So what regions seem to have been avoiding it? So it's important with the context that there are countries that are dealing with epidemic outbreaks and there are countries that are not. And so what are the countries that haven't dealt with it? Well, one of them is Singapore. Singapore is a case study of they had up to 100 cases. I think they're now up to 130, but they really turned it around and contained it. South Korea is a much more relevant case study because they had thousands of cases, a true outbreak of the same numerical scale approximately as Italy. But if you look on that link I shared with the charts, you're already seeing Korea is beginning to flatten out. And so this is the life cycle we need to focus on, is that even when there's an outbreak, and China definitely had an outbreak, there's a growth curve that goes up very high exponentially in daily new cases, and then it burns itself out and comes down in daily new cases. And what that looks like over time for total cases is an S curve. And you'll see that in the chart on China, and that China behavior pattern is behind every single chart. We put what did it look like for China, and these charts are all aligned for days from first outbreak, so you can kind of compare the life cycle. And when we look at Korea, it had a very similar behavior of China, but it flattened out much lower. Instead of going up to 80, 70,000 cases, they panned out close to 10,000. And they've really done a good job of containing it. So what are the two main methods that we've seen to contain this. We've seen the China example. It's a very authoritarian response, heavy quarantines, lockdown situation, sort of the worst case scenario from a civil liberty perspective of what you'd want to see in terms of and fear of people being locked in. But that's not the only response out there. And I think this is really important as we start to see this now moved into Europe and potentially the US, is South Korea and Singapore and Japan. There's a lot we can learn from them. And their approach was very, very different. Their approach was massive information sharing. And I'm talking not just sharing tweets on Twitter and, what scares us, but they had mobile apps that identified where infected cases were so people could begin sorting themselves around them and self-isolating those areas while they provided services to those folks to ensure they weren't isolated or left alone. So if you think about it, the China approach is to create steel barriers, literally block off alleyways and try and make blocks of the city and contain entire neighborhoods. Very heavy-handed approach. And the problem is, who's going to enforce that, right? As soon as you put up a barrier, someone's going to sneak around it, go behind it, go under it. And so you have all this monitoring and containment problems now. The South Korea and Singapore approach is we're going to provide you the information so that you can know on this part of town or in this block or on this floor, avoid this area, and people begin moving around those areas, and it's kind of like a reverse quarantine. The population begins avoiding the areas that are heaviest hit while the services are provided to the folks who are infected that need it. So I'm hoping as a takeaway that with all this panic and fear going on, is there are examples of how this can be contained, and that even when it's not contained, even in the China example, we see it grow up, collapse, and reach a point that is much lower than the overall infections of the population. China's now at day 70, and even in the Hubei province, where there's 65 million people, they have 80,000 infections. Now, there could be underreporting it. I did some analysis before that said maybe if they're underreporting by 10-fold or 20-fold or 30-fold, but still you're talking about a factor of the population that is much lower than the overall population. And I think this is important because I saw Angela Merkel's going out and saying the entire population of Germany is going to be infected. I don't know what data she's looking at. I don't know what structure she's looking at. That's certainly not China's example. Maybe she's talking over time of several years. But when we look at the data, and I'll get to this when we break into Italy, we're seeing the kinds of things we'd want to see, that the contagion may be slowing down. Even as the worst case effects of hospitals running out of supplies and things like that are happening, the daily new case rate is declining. So if the countries that worked well, it's all about information sharing, getting out front, taking it seriously. This is not a message of, don't panic, ignore it. It's take it very seriously, because some of the countries that have been hit hard, Benelux, Belgium, Netherlands, Luxembourg, they didn't take it seriously, and they kind of poo-pooed that it was a big deal, and they're now getting hammered. So you see these commonalities emerge. Take it seriously, provide lots of information, get out there in front of the concerns, and make sure that people understand what they can do themselves to limit this contagion. Now, the WHO just announced that this is a pandemic. And one of the big questions is, why wasn't this announced earlier? Why did it take so long for the WHO to come out and label this as a pandemic? Well, the WHO, the way it defines a pandemic is, an epidemic is a local, uncontrolled spread of a contagion. And if that contagion then transfers by a known passenger to a new place and spreads from that point, that may cause a second epidemic. So what you had is China was an epidemic, and there were travelers from China going to all these different countries that then started local epidemics. A pandemic, however, is when there's an untraceable contagion worldwide. So you hear this phrase about community spread versus, their person traveled to China, was sick, we know they spread from that. Community spread is we don't know exactly how it happened. That's the conditions of a pandemic. When that begins occurring around the world, that's when the WHO declares it a pandemic. And there's always this question of balance of, why didn't they declare a pandemic earlier? Why would that, be a bad thing? Well, most countries in their healthcare laws and their structures and their legal authorities actually have actions they are required to take by law as soon as the WHO declares a pandemic. And this will be one of these things debated is, would it have been bad if those countries had taken those actions had the WHO declared a pandemic earlier? However, in the past with SARS, WHO did declare a pandemic early, and it ended up being a nothing burger outside of China. And there was a lot of pushback. They declared a pandemic too early. All these laws got activated by statute, which required all this activity, and all of a sudden, enormous costs and consequences were accumulated. So it's a very tough choice. It's going to be easy to second guess, but the WHO was cautious on declaring a pandemic, even though if you watched all along, they're saying this is serious. It's probably going to become a pandemic. I liken it to, for those of you from the South, you may understand the difference between tornado watch and tornado warning and tornado on the ground. A WHO was saying, look, these are conditions probable for a tornado, but we can't call the tornado yet. We're not seeing it on radar. What's the objective measure we're going to use? But they're telling everyone tornadoes are in the area, prepare, pay attention, be aware. The pandemic now is simply saying we knew there were conditions for a tornado. Now we're seeing the tornado touch down. And so that's kind of the question on why WHO took a while for pandemics. Shifting to the United States, we've talked about. Yes, I touched my face, Ed. Glad your laptop died. So we're moving now to the United States, right? So we talked about these different regions that are suffering, and the response to the United States has caused a lot of concern because there was an outbreak in Seattle, Washington, actually Kirkland, Washington. So if those not familiar with the area, Seattle, you go across the lake. East side is Kirkland. There was a retirement or elderly care facility there named Life Care Center, and that has been the cluster of contagion that really got the national attention and the first cluster of infection. And this has raised a lot of concerns locally and within the U.S. because the response has been all over the map. There were probably 70 people were infected there. At least 10 or more have died. It has been a really tragic story. And the question is, why was that the first place? Why wasn't it a port of entry, San Francisco, or somewhere in Seattle? Why was it the elderly home first? And if you're in the Seattle area, it's spreading to other elderly homes. And that's the cause of why is that contagion happening? Well, when the WHO studied China, so the WHO came out with a report a week ago, and they went in and did, World Health Organization, CSI, on the China outbreak. What they found was that 3 areas or facilities are the reservoirs or the clusters where these contagions begin. Prisons, healthcare facilities, hospitals, and elderly residential homes. So right off the bat, that last one, those conditions that you have high proximity, high contact rate, a vulnerable population, that is an area that's ripe for a contagion to cluster. And even in China, the clusters were largely in these where elderly residents were congregated or more prevalent. That's where it had the highest impact. Life Care Facility had a contagion breakout there. And now we start talking about the national response and the U.S. response. A choice was made early on in the contagion. So these testing kits, a choice was made early on in the U.S. to say, we want a testing kit that will not only test for COVID-19, but all the other flu things that were out there. And that choice made in January had very serious consequences because it added complication to the test. So the tests themselves were, you got to make the test, make sure the test is safe, and then produce the heck out of it and distribute it. This is the process you go through for these test kits. In the U.S., it was make a test that can do many things. Classic U.S. need to overcomplicate things. There may have been rational reasons to do it at the time, but that choice is going to get a lot of scrutiny because the problem was they couldn't get that test working right. By adding that extra complexity, instead of taking something that was known to work just for COVID-19 that was already out in the world, they tried to do a multi-in-one, and as a consequence, something went wrong. They couldn't fix it. It was a quality control issue. They had to recall all the tests. And now they're just now getting back to producing these tests, and there's a 2 to 3 week lag in this. And one of the problems when you see these countries that have breakouts is they're not doing adequate testing enough. And you see Iran, if you go to that page with the charts, Iran is a great example where it virtually shoots straight up in growth cases. It probably had underlying cases already in the system, but they weren't being tracked. And so this consequence of not testing, getting the test kits out, means that the CDC had a choice to make when Life Care Facility had its first outbreak. The choice they made is, are we going to set the precedent that whenever there's an outbreak, everyone in the immediate area gets tested, symptomatic or not, and we know that's going to deplete our store of test kits immediately, or are we going to choose not to set that precedent? And that way we have some flexibility as things begin happening elsewhere in the country so that at each time we're not saying that the entire boundary of everyone who's interacted is tested. Because if you think about it, you have a limited number of test kits. If you give them all to everyone in a few cases, whether they're symptomatic or not, you may not have the test kits you need for those who are symptomatic and you really need to know if they have it. That was a second choice. These are policy choices. They have pros and cons when they're made, but that's a second choice that I think could stand some legitimate criticism here. And these choices, by the way, are not made by local officials. The U.S. structure is that the primary agency is Health and Human Services. They have the legal authority. Underneath them, the CDC is doing it. They provide the guidance to the doctors and the instructions of who gets tested when, and the outcome of those two choices. One is combining multiple tests into one, and then because of the error and the recall, being cautious on how wide a boundary we do on the testing, there's been a real lack of testing in the U.S. This isn't something Life Care Facility can decide. It can't decide we're going to test everyone, nor can it decide to quarantine people, because that's a choice under the legal authority of either the CDC or the state of government. So now what's happened, and I know this personally, Life Care Facility is actually a repository. No, I shouldn't say repository because these are humans. It's a care facility. If you are recovering from surgery in an elderly residential home in like a 20-mile radius, you're using Life Care Facility to do this. And I know that because my parents are living in Redmond, and they hate to say that they're in an elderly home. I'm sorry, Mom and Dad. You're old. It's an elderly home. That's the simple term for it. They use the residential place they live in has 500 residents, 300 staff, and they were using Life Care Facility. Their residents were going in and out of it right up until the point it was closed. My dad was there probably a month ago for something to do with ankle surgery, because in that area, and this was a question Christine asked before the call, in that area, you use this facility if you've had surgery and need to recover. So now all of these cases are coming back out and infecting the residential homes that they're from, potentially. And this is, of course, the fertile ground for COVID to break. And that's why the Washington outbreak has been so bad. It started in an area of the highest susceptibility. It then spread by this network effect into other areas of highest susceptibility, all while the testing kits are not available. There's conflicting advice coming down. As we see I'm not as familiar with other outbreaks as they're happening, but this is the learning curve effect of wherever a novel virus hits, it's going to be a novel experience for that country. And they're really going to have to step up and see how well do we do with something we don't know about. China was the first. They didn't respond very well, and they had to overreact with the quarantine and the systems. South Korea, Singapore, Japan got hit next. They performed very well. As it began to spread, every country is going to have a different response. And the key is this learning curve isn't just in the officials, it's in the population as well. Because if we treat it as, well, it's happening in China, it's remote, I don't worry about it, we may not be taking the actions to begin the social distancing and practice of don't touch your face, wash your hands, that type of stuff. We may not be taking it seriously. But I guarantee you 2 weeks ago, Italy started taking this very, very seriously. And so the learning curve isn't just officials, it's the population as well. And the best thing you can do in a contagion is that the population understands how to self-manage themselves so as to avoid contagion. And this is, don't have non-essential meetings, concerts, sporting events. I know people are upset that those are being canceled, but that's actually a good thing. You proactively cancel those, and then you don't have to do the kind of draconian measures China did, which probably aren't all that effective. And I'd love it if we could get the technology of South Korea and the competence of Singapore, but we probably can't import that. So the more we do these self-managing things in advance, the less we can spread the contagion and the more we'll flatten that curve. So I'm going to pause here and see what questions we had. Janos had, South Korea had much higher testing. South Korea has a drive-in testing facility. I mean, you talk about what's ready made for the U.S. They had a facility, you drive your car in, the virus doesn't deal well with concrete and metal. They have folks in hazmat. You're not exposing other people because you're in your car. They test you quickly. You drive through, you're on. They're running tests right now, I think last I heard in South Korea, 10,000 a day. I think the U.S. is running maybe 1,000 a day. And how do you... Jennifer asks, is it likely that there are asymptomatic carriers and it's only vulnerable populations that are actually showing the symptoms? That's certainly a possibility. There's a few cases now. Asymptomatic means someone is fully infected and not showing any signs. Those cases are not hugely common, but they certainly exist. And I think the very risky part is the mild case of COVID is it feels like the flu. And so even in mild or asymptomatic cases, people may not be taking care of themselves when they're sick the way they should not to infect. And this is one reason why the Netherlands has been hit so hard. The Netherlands came out, I think it's either the Dutch or the Netherlands, somewhere in the Benelux. They came out with a policy that said, unless you're actually sick, go to work. It's fine, right? You don't feel well, but you're able to work, go to work. And they kind of downplayed this. And that's one reason you're seeing this huge, relative to the population, outbreak in that area, is because they held street festivals. And there was a guy who was infected, but he didn't feel bad. So, go ahead, go to the street festival, and now they're finding that the street festivals had these spreads. So these things are very important that governments need to take this seriously, not downplay it and poo-poo it and say, oh, it's nothing, but say, look, what are the things you can do? If you're feeling sick, self-quarantine, self-isolate. If you have a choice to have a non-essential meeting that have a bunch of people standing around in close proximity or not, whether it's 10 people or 80,000 person concert, go with the not. Find a workaround for now if you can. These are the things you can do, which are the opposite of the draconian quarantine, where you try and forcibly keep people from interacting. People manage themselves, and that requires information and education. Let's go through here. Yeah, so one of the things you'll see on those charts, I have a risk band in those charts, and let me put the post up since we've had. The risk band is actually based off research that came out of the University of Washington based on China. And what determines an outbreak, and this is notional, this is illustrative and notional, this is not a peer-reviewed paper. I write for a blog that describes my hairstyle. Don't take this as fact, but notionally, what the University of Washington found is that there was a timeline and a risk band of cases, and when the confirmed cases crossed that risk band, that was where the opportunity of outbreak was highest. And when we talk about systems thinking, it's not just that the line crosses the risk band, it's the steepness of the line. So as you read these charts, if the line is very steep as it crosses that threshold, that exponential factor of growth is underway. And this is why I have two charts. One is total cases, the other is daily change over time. If you see a line that is steep approaching that blue threshold, and the threshold's a wide band. It's not like at 1,000 patients, this is a breakout. It's at between 800 and 1,200 seems to be where this happens. And you'll see that most countries that have had outbreaks, they're accelerating at a steep slope as they cross that blue threshold band. And if you look at the daily change rate chart underneath it, you see that there are 30% more cases than yesterday, 50% more cases than yesterday, 100% more cases from yesterday. So you can use those daily change charts to know where you're going. It tells you where you're going before you get there. The overall chart tells you where you're at. The daily change rate chart tells you where you're going. And it's that daily change rate chart that's also going to tell us when things have peaked. So on Italy, if you look at Italy and Southern Europe, it has a classic steep rise as it hits that risk threshold. And you can see it was doing it over a week ago. So it's not surprising that they're having the trouble they're having. But if you look at their daily change over time, and I may put this as an isolated because it's mixed with all the other countries, their daily cases are actually declining. The percentage change of daily cases means that we had, and think of this like a car. The car is speeding up. It's accelerating constantly. Well, the car is going a certain speed, but now the acceleration is decreasing. It's still going fast. So you're going to see Italy continue to have, I think it was over 9,000 a day, might be over 10,000 pretty soon. But the rate of acceleration of that change is slowing down. And that means there's less new cases or less percentage of increase in new cases than there were the day before. And what that means is if that decline continues, we've reached that breakout point where the contagion goes from rapid growth to rapid decline in daily new cases. And we get that S-shaped curve that showed in China that this is the extent of the outbreak. And it takes from China, we know it's 20 to 30 days if we use the Hubei example. And this is why I line the graphs up by day. It's 20 to 30 days for this pattern to play out. We're already seeing the first indications of the pattern playing out in Italy. This is, though, a few points of data does not a trend make. It's just noticing that it's beginning to decline. It could go up again. It could have another problem. Yeah, and the other problem Jen points out is at this time of the year, everyone has the flu and the sniffles. You're going to hear me cough. You're going to hear me sneeze. I don't have COVID. I'm not a zombie. Don't send someone to my house to take care of me or where I'm staying at. I did touch my face. I'm touching it all the time, but I am a trained professional. The problem with this is people are going to feel symptoms that could be COVID, and this gets back in that testing kit. If you send every test kit out to everyone who thinks they have COVID, if there's no plausible reason, they're not in a community where there's a risk of community contagion, they aren't connected to a confirmed case, you are going to be sending out scarce tests to try and capture low probability events where what we need those tests are is for high probability. And this is a bad place to be. You don't want to be, you want to test everyone if you can, but because of those early decisions that were made by the CDC and how they went through these tests, making these test kits, and then the decision not to release them, we're kind of in that spot where we're having to balance them. Let's see, what other questions? Is there serology testing yet? Would good to know antibody status, so things like healthcare workers who have had the disease being safe from disease. So this is Kathy, great question. The reality is it's probably less of the time to identify the antibody than it is to create a safe implemented version of it. So the general timeline that has been discussed by the CDC and the experts, the Health and Human Service experts on viral outbreaks, is you got to imagine 18 months. So the first tests actually, ironically, they're occurring in Seattle right now, and that is a vaccine test. But the vaccine test at this point, it's entirely with uninfected people. It's simply determining, is this vaccine safe? Not whether it works, it's is it safe? And the challenge of testing it in Seattle is you now have a population, you don't want them to have COVID-19 when you're doing this test because you're testing something different. And the cycle time of getting an antibody and vaccine test up and running, at least in the US, is probably going to be about 18 months. So a vaccine is probably going to be sometime next year. And if this becomes an annual reoccurrence, your quadrivalent will go into a pentavalent and you'll add this to your thing. But we don't know if it's going to continue. That's out the horizon when it's continue. I wouldn't expect, however, an antibody to be the thing that ends this. I would expect other factors, that growth and collapse curve. Maybe the virus doesn't do so well as we move to hotter and warmer months. There's a question, most of these coronaviruses, their half-life goes down if it's over 70 degrees. I'm not saying that's the case with COVID. It's not known yet. But a lot of these environmental factors will shift the infection from the northern hemisphere, which has been in winter, is going spring. It will shift it to the southern hemisphere, which is in summer right now. And that may be why there's very few cases in South America, or it may be there's very few cases because there's very few cases. There are some areas, I mentioned Pakistan, Bangladesh, India. There's not even 100 cases amongst 1.2 billion or 1.8 billion people. Now, that could be because they're underreporting. But I've talked to people who are working with doctors in the area. The doctors are on the lookout. They're not seeing it. They're not seeing deaths. They're not seeing serious hospitalizations. So there's a real question of why it's hitting some areas harder than others. But I think for the ones that are being hit, the commonality is to get ahead of it with information, practice your safe practices, and I'm really dubious on the heavy quarantine measures, whether those actually help. Any data on the lifespan of the event like this? So Jeff, in that chart, you'll see that the charts are aligned from days from first patient. So even though China, South Korea, and Japan, for example, in the South Asia, or US, Canada, the North American one, right, where it's got US, Canada, and Mexico, those are all aligned to start at the same point. So the bottom horizontal axis is days since first confirmed patient. That means that even though US started at a different time, started later than China, we can compare the life cycle apples to apples. We can fix that point at patient 1 is day 1 in that chart. And you can see then that China has a 70-day cycle through which the early part, like a month from January 1st through January 22nd, very little change and very little data because it wasn't being tracked very well. The WHO daily situation reports start January 22nd. So the actual full span seems to be about 70 days, but there's a little bit of uncertainty in that first part. From the breakout, though, to the top of the S-curve in China is about 20 or 30 days. So, we're looking at Italy having a breakout. They're going to be, and this is not a prediction. It's a forecast based on many contingencies we can't even name. 20 to 30 days from now, we're going to know whether they have leveled off and paused or not. South Korea appears to already be leveling off. But again, it's going to be very country by country because it's not just the nature of the contagion itself. It's the response rate, the ability to practice good social isolation, cancel the events. I mean, Italy had riots in prisons. Prisons, again, a big spread of this, and people are showing up to protest the riots in prison. You've got a situation where there's a lot of contagion opportunities. That's a tricky area to keep it under control. Germany might not have the same problem. The Nordic countries where they all stay to themselves and light their candles to be happy, that might, they might be able to contain it. It's not known yet how this is going to vary based off social, cultural, and environmental practices. All we have to go on is the basic structure of the virus, which itself is a exponential rise, exponential collapse of daily cases, and then the S-shaped curve. Have I seen it being the norm elsewhere? Well, we haven't had anywhere else run 70 days, but even the worst contagions right now, so the worst contagions in the world right now, and I shouldn't say that, the contagions that are serious, because we're still only talking thousands of people, are in Iran, Italy, if you think population-wise, Benelux. Some of those, however, are already starting to show declining new cases. And the key thing there is we don't know if that's a reporting factor. I'm using the WHO report, so I'm dependent on the data that comes from the World Health Organization. I do not go out and interview these people personally. So if the country is not reporting to the World Health, that's going to not show up in the data. But we're already starting to see declines in daily new cases, which may mean that those areas may be peaking. Now, the trick here is there's lots of areas where the outbreak hasn't happened yet. And that's where the United States is on a path to have an outbreak. Now, when I say outbreak, I'm not saying 300 million people get sick. Even in China, it tapped out at about 80,000. In fact, if you add up every confirmed fatality around the world, it's nowhere close to China yet. And I think if you add up all the cases, it changes a lot. But I think there's 120,000 maybe cases right now. Something like 80 or 90,000 of those are in China. So still, the overwhelming impact has been in China, and even the outbreaks that are bad relative to everywhere else, Italy, Iran, are not as bad as China. And that's, I think, the key lesson is this learning curve that I talked about that both governments and people go through. China was the first, as a government, as a people, to go through this learning curve. And they made choices by suppressing information early that are not successful in containing contagions. They paid the price. They had to use heavy measures that we don't even know if it was effective that well. Other countries that learned from that took it seriously. South Korea, Singapore, they've been able to either cut it off, contain it, or manage it much better. Countries that ignored that lesson, Netherlands, Italy, perhaps, they're dealing with Iran certainly because there was a suppression of information at first. They may have to go through that similar China life cycle where you see that over the full 70 days. Per capita data. So Jeff asked a question. I didn't plot the charts in per capita data. This gets pretty technical, and I don't want to lose half my readership. But I do want to point out that per capita data is useful for analyzing impact, right? What is the impact on the population of this disease? When it comes, the point of those charts is to inform, are we facing an outbreak or a containment? And that's a different question. Per capita isn't as useful there because a disease doesn't need to hit a certain threshold of the population to have an outbreak. It looks like at about 1,000 people, the containment begins to break down and you begin to have this rapid acceleration. And that's because, if we did per capita analysis, even Hubei, the province in China, 65 million people, 80,000 ended up getting affected. That's 1% of the population. You could do a per capita, but it's still a very low amount of per capita. And what I've found also is presenting per capita rates, most of the audience, I'm already using logarithmic scale and change over time. So I'm pushing the envelope here of what I think people can get, but I want to be careful on that. So other questions that I had here. Should we panic? So this is a question, right? It's a very big topic on social media. Should we panic? And I want to touch this. If you have more questions, add them so that I can take care of them as we're getting. Well, I'll do this, by the way. I'll do this again on Saturday for all who missed it the first time. And quick plug: if you like what you're hearing, do the Patreon thing. Help support Patreon. You know what to do there. But talking about should we panic? My answer is always no. We should not panic, but I want to give you my perspective on what I view panic as. So fear is okay. Concern is okay. There's a misunderstanding in my, I deal with violence and instability. I'm usually studying terrorism, counterinsurgency, really bad situations. I was deployed for 2 years in Afghanistan. There is no time you don't have fear. I don't care who you are. If someone says, I'm so tough, I don't feel fear, they're lying and sort of projecting. Courage is not the absence of fear. Courage is what you do when you're scared. Right? And so I view panic as being scared and using that fear and projecting it onto others to the point where their only takeaway is to be scared themselves. And it's not necessarily done with ill intention. It's probably done with good intention. But there's a difference between I am scared and I am going to do something locally, nationally, in my neighborhood and alert people. That's a courageous action. Spreading we're all going to die and stuff like that may be intended to raise awareness and advocacy to get governments moving, but the unintended consequence of that panic, and I can speak from it fairly personally, though indirect, is that you're not giving people a rational action to do. They're going to go out and do what the herd does, and apparently that involves a lot of toilet paper and like Purell are off the shelves, and the real serious one is all the masks and gowns that the actual healthcare workers and patients need. There's been such a run on supplies, they're no longer available. So the place my parents are at has a medical facility on site where residents who are sick or susceptible, they can live on site and be taken care of. That place no longer has access to gowns and masks because they're not available anywhere in Seattle because people who didn't need them went out and bought them all. Now, that's a consequence, but what's an action you can do in response that is to me like an example of courage? Well, I think it's great in that the doctors and nurses of that facility got a hold of the medical material that is used to make these masks and the gowns, and they gave them to all the little ladies quilting and sewing clubs, the stitching and all that. And those groups organized themselves remotely and safely to create more gowns and masks from the material. So you have this cottage industry and at the facility they're at, and I'm sure this is happening elsewhere, people who are doing those quilting and sewing groups are making masks and supplies to help the people locally that are there. And that's a good example of an action and courage because it's helping locally. And so my question is, yes, raise awareness. Yes, raise advocacy. But do you know who your neighbors are and have you talked to them in the last 5 years? Do you know who in your area needs help and how to help it? I've had offers from people willing to drop off groceries for my parents. That was a fantastic, how do we build networks and resilience even while we're in fearful? That is probably a good reaction as opposed to just being in a fear state and letting that spin. Let's see, define panic. I think the hardest part in the Seattle is inconsistency of how to respond to the general public. This is Christine. Yep, 200. So this is the point. Okay, so what her question is in Seattle, the governor announced, it was either last night, a fairly extreme measure, no more gatherings over 250 people. And the problem, this gets back to when I talked about countries that do this well, they get out in front of the information curve and they stay out in front of it and they stay consistent. And this has to do with education, preparedness, and communication discipline. In Seattle and Washington State, you've had, and partly because they're being influenced by the CDC, you've been getting conflicting guidance from the CDC. That was happening with the local issue on who gets tested and not. I've seen some examples in Georgia in place where doctors are getting in conflicting guidance. When messages are inconsistent in a panic situation, that is worse than anything because what people want is credible, reliable, if I do X, Y will happen and Y is good. So if you tell them X and they do X, they expect Y to happen, but then you say, oh, don't do X, do Z or do B or do something else. You begin to create this concern that I can't trust what I'm hearing and I don't know how to act. And humans get very quickly this cognitive overload where they shut down and either fixate on one thing like buying toilet paper, or they just don't do anything. And mentally, it's easier to say, it's no big deal. We'll be fine. Don't panic, go do about your stuff. But that's not an informed decision. That's their mind saying, I can't process all the conflicting guidance. So the science here of groups and gathering, and I mentioned this earlier, you want to avoid non-essential gatherings if there is a breakout in your area, because that helps flatten this curve. So there's this curve of this growth and collapse. If the curve is really, you can think about the area under this curve is the number of patients in total. And if it's a very skinny curve over time, those patients are all going to hit the system at the same time. If you flatten that curve out, there may still be the same number of patients, but it's spread out over a wider time, and you get more facility access, resources, and healthcare. And this is an example of what's going on in Italy. Now, I've tried to chase down some of these stories coming out of Italy. As far as I can tell, it's not that the entire country has collapsed. Most of the cases are concentrated in the north. And it's not that the entire healthcare system has collapsed. There are certain localized areas that are experiencing that sharp rise and fall. And the area under that curve is overwhelming those local resources. What that means is it's kind of like when Katrina happened in the US. The hospitals in Katrina had to make very stark life and death choices with limited access and limited resources. And that's a failure not only of the state, the local, but also the federal government to not come in and help. But it didn't mean that in Milwaukee or Atlanta during Katrina, those places were having to face the same choices. So COVID seems to be very, very localized. And you hear this data, 80% of the cases in China were in Hubei, 80% of the cases in Hubei were in Wuhan. I'm sure when we get the data, 80% of the cases in Wuhan are in a small area. You get these clusters. And so this question of, do I let my kids out or how do I go about my daily life? First of all, we know a couple things about the virus. When you cough or sneeze, this is a droplet. It's not aerosolized. It won't stay in the air. It's like a little catapult shooting a pumpkin of badness, and that pumpkin's going to fall on the ground 6 to 12 feet later. It will stay on the ground. It has a half-life, I think, of about 12 hours, or maybe the half-life 6, so the total life's 12. It doesn't hang around for long. Metal surfaces, fabric surfaces, it dies off pretty quickly as in open sunlight. There's probably variation. If you put it in a sock drawer with the ferrets, they'll probably last longer there, but it is something that can be prevented by not being in the proximity. And if you can't avoid being in the proximity, the only way it can infect you is if you take a droplet that's on your hand and do what I did at the beginning of the show, which is touch myself all over. Now it's on your face. Now it's getting in. That's how it infects. So if you are going out, I think if there are still activities, and I got 2 daughters, so I know how hard this is, right? How do you have a 6-year-old not touch everything and put it, and that's just hard. But you practice not touching your face, washing hands regularly. I ask people, when's the last time you practiced not touching your face for a full hour or washing your hands before you did? And those are the kinds of things that if you are going to go out, those are the practices you should practice. As far as to concerts and conferences and sporting things, I think canceling proactively is probably a good thing. You're asking, should we cancel non-essential things now or risk essential things later? I think the governor finally got on the ball late last week by saying, let's stop these sporting events, let's stop these large gatherings. And this is backed by the UW research. So I made sure that his recommendations came out of the same University of Washington research I'm quoting, and they were basing theirs off of a study of the WHO data that came out of China. And it's these measures I think are good. Whether 250, I mean, if it's 10 people, it's 250 people. Where that number falls, you got to be careful, what you're doing there so you're not spreading panic or creating a civil liberties issue. But I think right now people should ask themselves, this meeting I'm about to engage in or this event, is it necessary and essential that I do it? If not, maybe reconsider. Do I see movement for better scaled up responses like home delivery food, SNAP free or reduced lunch so that schools can close or people can stay home? I haven't been tracking that, Ed. That's a good question. I know that what's successful in South Korea and Singapore is to share information on where the infected are so that people isolate around them and then deliver services to those people so that they are sustained. But I don't recall South Korea having a bunch of working from, it's not like South Korea shut down. They let the people have the information and began moving around the cases themselves. And there's a middle ground there. When it comes to scaling, I'm like, why aren't we taking the digital apps that South Korea and Singapore have developed, porting them over? I'm not a technologist to the point of knowing if that's easy or hard, but why aren't we using systems like that? Why aren't we preparing for it? I think anything you can do at a community basis, there's big P politics, national, federal, state. There's little P politics. What do I do in my neighborhood? What do I do? You're part of a gaming organization, part of a club. I would be one of the things that came out of China is all these people are isolated. They started sharing cooking recipes with each other. If any of people are in social groups that are gaming or reading or fandoms, how can you make events that keep people entertained while at home? I mean, in some ways, this is the champion of the introvert. Like, our day has come. We know what we're doing here. Twitch, anything you can do to create a sense of community to maintain that sense while people are canceling those non-essential is probably a good thing. So Sabrina asked the question of the balance between social distancing, decreasing person-to-person spread, and the negative effect on mental and financial health. So this is a key question. One of the things you don't want to do in a quarantine situation is so isolate the people that they actually begin having negative mental health things, because that reduces their body's ability to fight back, recover, and can lead to other negative outcomes. And there's a balancing act where I would say what you want is the population to not go and be infected, but you still want to have plenty of services delivered, even if it's by friends of neighbors who are taking care of themselves and exercising good practices. You don't want those people to feel socially isolated. And this gets back to Ed's question about how do we scale responses? Well, neither you nor I can make a determination on SNAP, but we can certainly set up, Grubhub runs for locals, or coordinate on how to have a Twitch event that would have been an in-person event, but now we're doing it on Twitch. And I think building that community type efforts just is a force multiplier to what the government and the state is going to do. They're going to focus on the worst case scenarios, and they're going to be focused on the absolute necessity because they're going to quickly get overwhelmed. But that's going to leave a lot of gaps. And those gaps can be filled by the elderly ladies of the Emerald Heights facility getting together their quilting groups and making masks. I mean, that's a great response. So For those stores that have been cleaned out, if there are any amped up production, John Sewell asks whether this is more of a supply question. If you're out of toilet paper, John, thoughts and prayers. Good luck. So the question is now, this is more logistics and supply, and I want to make a note here. As a forecast, I think the economic impact of COVID-19 will far outweigh the healthcare impact. And that's not to diminish the people who will pass away, die, or have serious consequences. It means that the disruption that is happening right now in the economic space, magnified by the oil wars that are going on between Saudi Arabia and Russia, totally separate live Facebook comment, that's going to have a huge economic. And part of this is every supply chain of anything that's made physically anymore, in some way, shape, or form, runs through China, and China has been out of work for 3 weeks. So as stores run out of supply, there's a whole network now that has to supply them. And those networks, if they're being fed in any way from China, either have to source from different areas or simply wait till it comes back up. Now, China is getting back to work. They're, like I said, they flattened out and they're kind of restarting the production. So I think that's a short-term thing. And you know, my view is if you're going to use it anyway, it's okay to buy a little extra, but don't buy everything in the store. Don't be that jerk or that person that, takes the last one from everyone unless there's only one. And by all means, if you don't know what you're doing with something and you're just buying it on impulse, like it's a mask, you don't know how to put it on, you don't know when to put it on. I can't tell you how many people I imagine put that mask on, feel really safe, walk outside, spend an hour outside feeling safe, come back home, take their hands, put the mask off, and then touch their face. If you don't know what you're doing, don't buy something and hoard it, because what I don't want to have happen, or what we all don't want to have happen, is that people have these shelves of masks for the next 6 years in their basement that they never got to use, and those masks were needed by people who needed them. And so we're getting to about 50 minutes and 45 minutes into the hour. I'm going to scroll through here, make sure I've covered most of the questions. Yeah, Lori, I saw your thing about the German chancellor's prediction. She expects 70% of Germans to contract it in the coming months. Do you think that's overly cautious? I think it's overly, I don't know where she's getting her data. China has had this for 70 days, and they do not have, they don't have anywhere near 70% of their population. They don't even have 1% of their population who has it. So even if China was underreporting by 10, 20, 30-fold, Germany would have to be 50 times worse than China, 100 times worse than China, to see that level of outbreak. Now, maybe what she's saying is that over the long term, this virus is going to be around and with us for multiple years, and therefore, over time, the majority of the population will be exposed to it. That's a valid case to make. But in the next few months, and I could be corrected and wrong, there could be zombies out wandering around a week from now, and this video will look kind of funny. But I don't think you're going to see anywhere near that level of infections. And I'm nervous when they make statements like that, because I'm wondering where they're getting their data or their system structure. And there are better ways to inform and warn people to get them to doing the practices rather than we're all going to get it. Good comment. Again, check out, if you like this content, like, follow, share, do all that fun stuff. You know how to do it. Check out the Patreon. It's at InfoMullet. You click the Learn More button in the upper right. That'll take you to it. We started it this week. Appreciate all the support, all the Mulleteers who have signed up. And again, I'll be doing another one of these Ask Me Anythings on Saturday. And if there are zombies by then, I promise full coverage, because I've been waiting for that day. But I'm going to do this again Saturday night, 6 p.m. Eastern, and we'll have some updates. And when I get this video and post it to YouTube, I'll go ahead and share all the links that I've been referencing in it. I know it's hard with all the scrolling. I appreciate all the participation. I like all really good questions. And so I'm going to go ahead and end it. And hope everyone has a good day. Don't touch your face. Don't do this. Have a good day. Be safe. Take care. Bye-bye. Thanks for watching the video. Hope you enjoyed it. If you'd like to follow the InfoMullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a Mulleteer and support the InfoMullet, visit us on Patreon. We appreciate the support.